So last week the Minister announced the reconfiguration of paediatric services throughout Northern Ireland. We in the Western Trust need to urgently reconfigure our services to make sure that we have a robust and resilient paediatric workforce from a medical point of view and a nursing point of view. We are consolidating all our services on one site to make sure that if and when our staff do either have to self-isolate or go sick, that we are able to provide a safe and effective service to the children within the Western Trust area. So that will mean the paediatric services currently being delivered within the Southwest Acute Hospital will in part be delivered in Altnagalvin Hospital. This is a temporary but necessary measure that we need to take to ensure the children get the best possible medical and nursing care. We will ensure that no child at any part of the Western Trust suffers as a result of this. There may be a temporary inconvenience for some families, but this is the best and the safest service that we can provide at this very challenging and difficult time.
Hi, I'm Dr. Nick Lipscomb. I'm a consultant paediatrician and I'm the clinical lead for paediatrics in the Southwest Acute Hospital. And I'm here to tell you about the changes we're making to help us fight COVID-19. First of all, let me reassure everyone that there will always be a children's doctor present in the Southwest Acute Hospital should your child get sick. But we're going to have to make some changes. And one of the things we're going to do is move to an ambulatory care unit here rather than a full inpatient unit. This means that during the daytime your child would come up if they were ill and be assessed and stabilised. And if we could get them better so they could go home, they would do. If not, they'd then be transferred to another hospital if they needed to stay in hospital for a night or two. If your child becomes unwell at night, they would be stabilised in our ED and transferred to another hospital. We're also going to be making some changes to our neonatal unit. Let me say that these are temporary changes during the COVID-19 period. We're going to not have a neonatal unit on site, but we are still going to have a labour ward. Babies are still going to be born in Fermanagh. And if they need help from a paediatrician, there will be a paediatric doctor on site 24/7 to give that help and to train the neonatal nurse. If a child does need admitted to a neonatal unit, they will be stabilised and transferred safely to another hospital. Following that, if you're coming labour and you're premature, we may need to move you while you're in labour in an ambulance to another hospital. But all these things are done so that we can free up space to treat patients with COVID-19, that we can continue to provide safe services at a time when staff are going off sick, and above all, so that we can ensure that there is paediatric cover so that the children of Fermanagh are provided with good medical cover to stay well.
Hello, my name is Dr. Jerry Mackin. I'm a consultant paediatrician here at the Southwest Acute Hospital in Enniskillen. As part of the surge planning for COVID-19, we've had to make some difficult decisions in planning for how we're going to maintain a safe service for children within Northern Ireland. There's been extensive discussions with both nurses and managers and doctors within the paediatric service, both in the Southwest Acute Hospital and in all the other hospitals in Northern Ireland. Our aim is to help maintain patient safety. Obviously, many doctors and nurses are going to become sick over the next few weeks and months, and we need to maintain a level of patient cover in order to allow all children, be they have COVID or non-COVID conditions, to be managed safely within the health service. As part of that, what we have arranged to do is to decrease the hours of opening within the paediatric service here in Enniskillen. Initially, both Enniskillen, Causeway Hospital in Coleraine and the Daisy Hill Hospital in Newry will all be switching to an ambulatory model of paediatrics. That means we will be open from the hours of 9 a.m. to 10 p.m. in the evening. During that time, there will be a consultant presence within the hospital, as well as more junior doctors as well. Out of hours, there will also be senior paediatric doctor here in the hospital in Enniskillen in order to cope with any emergencies that come through the emergency department, and also to cover any deliveries that happen to be born here in Enniskillen. Obviously, this has been a very difficult decision for us to make. we have maintained our aim through all of this is to maintain the safety of patients in the Oma and Enniskillen area. We also want to make sure that there are beds available for adult patients within the hospital should they become unwell with COVID-19. I have to reinforce that this is a temporary measure to cope with a completely unprecedented situation we're now in here in Northern Ireland at this point.